Hi, I'm Dr. Jeff Greenfield from Deer Park Veterinary Hospital, and I'd like to talk to you today about the importance of good dental hygiene and why regular dental appointments for your dog is important to maintain their health. Uh, Zach is here today to ask some questions and help you to understand the importance of dog dental health.
Dr. Greenfield, how does dental health impact the overall health of my dog?
Sometimes it's surprising how much the dental health is important. People just think about bad breath as just being a nuisance, but it can actually lead to other much more significant health issues for pets. So it's something that's highly important to maintain their long-term health and longevity.
And then how can I care for my dog's teeth at home?
There are a few things that you can do at home. First of all is some chews. Whether it be a chew like a treat that the dogs eat that helps to get some of the plaque off, or specifically made toys or chews that are designed to help clean the teeth. Those can help to get off some of the plaque before it becomes tartar. A little bit more beneficial is a rinse. So sometimes there's some water additives or some sprays that you can do, kind of like a Listerine, to help disinfect the mouth and decrease the bacteria that's there. The most important thing and the biggest help you can do at home is actually brushing your dog's teeth. If you think about people and their dental health, people will brush their teeth every day but still go to the dentist for regular cleanings. So the brushing can really help us to keep the dog's teeth healthy in between cleanings.
And then what are some signs and symptoms of dental disease in dogs?
Typically, the first thing people see is some discoloration of the teeth. That's the tartar building up. They're not bright white. You're seeing some tan or sometimes greenish to brown coloration on the teeth. Then people will notice bad breath or halitosis. That indicates that there's bacteria in the mouth that's causing that odor. As things progress and get worse, we can see dogs that sometimes don't eat normally. Occasionally, they'll pick up the food and drop it a few times before eating it, or they'll take longer times to chew if there's a painful area. And sometimes dogs are just a little grumpy or less active. I've had clients over the years who didn't really notice much difference in their dog's behavior until they got the teeth cleaned and then saw how much happier and more active they were after that.
What are some of the common dental diseases we see in dogs?
The most common dental disease is gingivitis. That's inflammation of the gums as a reaction to that bacteria that's in that plaque and tartar. We can also see some growths in the mouth. Some of them are benign or non-cancerous, don't cause any trouble. We do also see some cancerous growths in the mouth. Cats are much more likely to get aggressive tumors in the mouth than dogs, but we certainly can see some in dogs as well. So certainly if you see any kind of abnormal swelling, redness or irritation in your mouth, you should certainly have us take a look in your dog's mouth, and we can evaluate how important it is to get that dog under anesthesia to get that fully evaluated.
And why is early detection and diagnosis of dental disease so important?
Dental disease can certainly progress. Early on, it's just a nuisance with the bad breath and the irritation of the gums. But as dental disease is neglected, we can see that problem progress. The bony support for those teeth can erode away over time. Those teeth can become loose and painful, and the dog can lose teeth. And we can also have the bacteria from the plaque and the tartar get into the bloodstream through the inflamed gums, and that can get to the rest of the body and can actually cause certain type of heart disease affecting the heart valves and can cause problems with the kidneys. So it can certainly affect the dog's overall health and longevity.
And how often should my dog's teeth be checked?
We will check the teeth with every exam. So certainly at least annually for young, healthier dogs. For senior pets, we recommend exams more frequently. And certainly if there's any issues, if the dog is chewing on something hard and cracks a tooth, or there's anything abnormal that you find, you should have it checked at that point.
And then what is a professional dental cleaning like for a dog?
Unfortunately, we can't really do a good thorough dental cleaning with dogs being awake. So that does involve general anesthesia. So we commonly do some blood work before that to assess the dog's overall health, make sure that they're in a state where we feel comfortable putting them under anesthesia. And they'll have a tube placed in their airway to protect that airway because there's some water that gets sprayed. We don't want them breathing that in. Technicians do a very thorough job cleaning the teeth. We do full radiographs of the entire mouth, so x-rays of all the teeth so we can find problems below the gums. And then the doctor examines the teeth, and if there's any problem teeth, we would address those with treatment options, including more involved treatments underneath the gums or potentially extraction if the teeth are to the point where we can't save them. But we would get more into that detail once we find out what's going on. We contact you.
Okay.
It's an outpatient procedure, so the dogs would be here just for the day and go home and pretty much back to their normal selves typically by the next day.
And if there's, if any clients think that their dog needs to come in for an exam or anything for any dental issues, what would their first thing to do? What would they do?
Just get in touch with us. Give us a call. You can also reach us by text or email, and the CSRs can get an appointment with you, and we can evaluate what your pet needs.
All right. Well, thank you very much, Dr. Greenfield.